Can teething cause mucus diarrhea? A small amount of mucus in a baby's poop is likely no cause for concern if there are no other symptoms. However, large quantities of mucus that appears in several stools in a row, or accompanying signs of diarrhea could each point to an allergy, a gastrointestinal infection, or another problem. The intestines naturally secrete mucus that helps coat the intestinal tract, digest food, and pass stool. Sometimes, some of this mucus ends up in poop. A small amount of mucus in 1 or 2 diapers, especially if there are no other symptoms, is usually not a sign of illness. Sometimes, mucus appears in large quantities or it recurs for several days. In this case, there is more likely to be an underlying issue. Here, we take a look at some of these causes and explain when to contact a doctor. Diarrhea. In a baby with diarrhea, the runny, loose stools may contain mucus. However, in babies that breastfeed, it is common for the poop to be loose and somewhat runny, so it can be difficult to tell the difference between regular stool and diarrhea. Allergies and dietary changes. Allergies and food sensitivities can cause diarrhea or lead to mucus in a baby's poop, though this is uncommon. In babies that breastfeed, a sudden change in the mother's diet may be the cause. Sensitivities to iron, soy, or other formula ingredients may also play a role. Breastfeeding changes. Changes in the way that a baby breastfeeds can affect the texture of their poop. For example, some babies who feed for short periods before switching breasts have frothy green stool. If a baby breastfeeds, their stool may seem to contain mucus. This can happen when the baby gets more foremilk than hindmilk. Foremilk is the milk available at the beginning of a feed, and it can be thinner and sweeter, while hindmilk is available at the end. Feeding on each breast for longer periods may help. Bleeding. A baby may have blood and mucus in their stool. If the stool is very hard, this could mean that the baby is constipated. The blood and mucus could come from tiny tears in the baby's anus. Ensuring that the baby consumes plenty of fluids may help.